My name is Andrea Garcia, and I'm running for judge of the Riverside County Superior Court, seat number 10. I am an immigration deputy public defender. I have the most judicial endorsements of any candidate in this race. This is because of my broad and comprehensive experience. For nearly 20 years, I have practiced in both federal and state courts, defending due process for those seeking the American dream. I have defended children like my client I call Sophia, who was brought to the United States by human smugglers after losing both her parents. I was able to successfully obtain a guardianship for her in state probate court and then defend her against deportation. Today, Sophia has a safe place to call home. I am running for judge because I believe in due process and the rule of law, and I believe that in a healthy democracy, independent courts are a cornerstone. My name is Andrea Garcia, and I'm running for judge of the Riverside County Superior Court, seat number 10. I hope to earn your vote. Thank you.
Andrea Garcia is proudly endorsed by the Riverside County Democratic Party.
When we ban abortion or make it illegal, we make it unsafe for the woman, right? We know that from the history in our country prior to Roe of people dying. So what they discovered was that, yes, indeed, this would induce a miscarriage. They experimented with the doses. They talked to one another. They shared information. And lo and behold, just women to women sharing this information resulted in dramatic decreases in the amount of sepsis that was occurring. And the doctors noticed. They're like, where are all the women who are having abortions who come to me with sepsis? It wasn't happening anymore. So it's a really remarkable story about how women were the ones who really figured this out and then shared with each other.
Welcome to Democracy on Fire. Today, we'll be discussing how women are exercising power and reshaping abortion access in this moment. We'll delve into the crazy abortion pill case that's working its way through the courts and visit about just the state of things as they're emerging. My guest is Elisa Wells, a public health specialist with more than 30 years of experience in the reproductive health movement. She specializes in emerging technologies and innovative approaches to reproductive health care, including emergency contraception and medication abortion. In 2015, she co-founded Plan C, which is a groundbreaking campaign that sheds a light on the over-medicalization and over-regulation of abortion pills and advocates for a safe, effective, self-managed option in the U.S. to counter the politics and stigma that have crippled access. Since then, Plan C has grown to become a leader in the movement for reproductive rights and abortion access. So welcome, Elisa. So glad to have you here.
Well, thank you for having me, Kay.
What is Plan C? Tell me a little bit about how it works for people.
Sure. Plan C is an initiative we started in 2015 to help people understand that abortion pills are safe, effective, and could be much more widely available and less medicalized than they had been previously. We saw the availability of these pills in other countries and in other ways, and we knew that we could make an impact on their availability in the United States to just make them more directly in the hands of the people who needed them. So we do research and we provide information to people about how these pills are accessible from every state in the United States currently.
So what is this legal suit about, and how is it attempting to restrict women's access to abortion generally and to these pills?
Yeah, it's complicated. I'm not sure I can fully explain all the details of the case, but it is a case brought by the state of Louisiana against the Food and Drug Administration. And the Food and Drug Administration is the regulatory agency that approves and regulates mifepristone, which is one of two pills that are used commonly for abortion. The other pill is mifepristone, which is widely available already in the country, has been available for decades, and is used for many other things. This lawsuit by the state of Louisiana seeks to prevent the mailing of mifepristone. As you know, over the past 5 or 6 years, telehealth abortion has really taken off in the United States. It was the logical answer to access during the pandemic. And at Plan C, we did a lot to try and get less medicalized routes of access and telehealth set up and operational in the United States. And that's really taken off because people like the convenience and the confidentiality and the control it gives them to just get abortion pills in the mail. But the state of Louisiana, in this case, is upset because pills are coming into Louisiana, a state that totally bans abortion, from providers who are in other states who are prescribing across state lines. So they're trying to challenge the FDA approval of mifepristone and specifically the approval for its distribution by mail, by telehealth, and hoping that that will stop access in Louisiana. But because the FDA is a federal agency and they're challenging the federal regulation of mifepristone, it applies everywhere in the country. A decision in this case is not just about Louisiana, it's about the entire United States.
So could this suit stop telehealth prescriptions of mifepristone throughout the United States? I mean, is that something they can legally do?
Well, I can't comment on whether they can legally do it or not. I'm not a lawyer, but that is their intent. Their intent is to stop the mailing of mifepristone across the country. They think that that will stop the mailing of abortion pills into Louisiana and everywhere, but they're wrong about that because abortion will continue by mail regardless of the outcome of this case. We know that there are many other medications that can be used, including the mifepristone alone. And we also know that there are many routes of access to abortion pills in every state now that will not be impacted by any court ruling.
So how do the shield laws work? And which states have shield laws?
That's a great question. Shield laws are new and a lot of people don't understand them. They're called shield laws because they shield the providers who are prescribing abortion pills across state borders. Normally, the way telehealth is set up to work is that the provider has to be licensed in the states where the patients are sitting. But shield laws, which have been passed, well, in many states, but there are 8 states where the shield laws are particularly strong and where abortion providers feel that they protect them from any kind of loss of their licensure or extradition or any kind of prosecution against them. So states like New York, California, Massachusetts, and others that are trying to protect these providers who are trying to serve the patients that are coming to them. So these telehealth providers have made a decision based on the strength of these shield laws that they believe will protect them to do telehealth across the state lines. And so the shield laws, some of them actually change the location of the service. So instead of the telehealth provider needing to be licensed in, say, Texas, they changed the location of the service to be Massachusetts. So a provider sitting in Massachusetts who's licensed in Massachusetts and following all the rules and regulations of Massachusetts for practicing medicine is then protected as they help a patient in Texas or Alabama or any of the other states that are politically restricting access to care. So these shield providers have been operational since 2023. Aid Access was the first to go this route and open up access across the country. They provide FDA-approved medications, mifepristone and misoprostol, to people who request access. They do a medical screening. They have support services available to people if they have questions along the way. And they're basically just doing a brief medical screening because there's not that many contraindications. The drugs are pretty simple to use. They provide instruction and they mail the pills. They often arrive in 3 to 5 days, 7 days. The person takes them at home, which is the same as if you went to a clinic. You'd get the pills and you take them home and you take the pills at home. And then they have the abortion at home. So this has been going on since 2023. And we know that there are probably 15,000 people each month getting pills in this way through these telehealth providers in the restricted states.
What percent of abortions are now done via pills as opposed to other procedures? Is that becoming more widespread?
Absolutely. The use of abortion pills is very widespread in the country right now. The latest figure, which is just still a few years old, is about over 2/3 of abortions in the US are done using pills, with a lot of those being done through clinic-based care, people going into a clinic, getting the prescription for the pills and picking up the pills in person. There's a little bit of picking up pills at a pharmacy, but that still lags behind what we know about other forms of medication through pharmacy. It has been restricted until recently, so the pharmacies are still sort of getting set up with access through pharmacies, but you still pick up the pills either at the clinic or pharmacy, and you take them home and you take them. But telehealth is really taking off, and now that the latest figure is that there's probably more than almost 30% done by telehealth in this country right now.
Was that affected by the Dobbs decision? Or how did the Dobbs decision, what did it do and how did it affect the landscape for abortion in the United States?
Yeah, you might think that the fall of Roe v. Wade would have adversely affected the overall numbers of abortions in the United States because it was such a drastic effort to stop abortion in this country. But interestingly, there's now more abortion than there was prior to the Dobbs decision and the fall of Roe. Certainly, access through clinics has become more difficult because clinics have had to shut down in some states that have further restricted access to care following Dobbs. There's a lot of states that have had trigger laws that, all of a sudden, they put into effect a total ban on abortion, or they really restricted it. A 6-week ban is practically a total ban. So I think, certainly that decision caused a lot of harm for abortion access in the United States. But because we had telehealth set up, and then with the advent of the Shield laws just a year later, there has been a growth in the number of abortions that are happening in the U.S. since the Dobbs decision.
So as you look at the current court, do you feel confident that abortion access can be maintained, given the history of the decisions that they have been making?
Well, I feel confident that abortion access will be maintained, but not because of the court. I do not feel confident in the court to make a decision that will benefit abortion access. But the reason I can feel confident that access will remain is that over the past 10 years, a lot of systems of access have been built and grown in the United States that are providing access outside of the formal regulatory environment. So these are access routes that we research and that we transparently share information about as a form of public health harm reduction to let people know, here's what we know about how people are finding pills in the United States to safely self-manage an abortion. So I'm happy to walk you through, what's available in the United States right now.
Tell me about that.
Yeah, it's really quite amazing. We first started researching access to pills on the internet in 2013. We thought, we live in a global marketplace. We know that these pills are readily available in other countries. We wonder if they're available in the United States. So we went online, we searched in English and Spanish, and we used what we thought would be common search terms. How can I find abortion online? Can I find abortion by mail, abortion pills, all these different search terms. And we started finding sites that claimed to sell abortion pills. They looked a little scammy. They were pharmacies that were advertising that they sold these pills. And then we started seeing in chat rooms that women were asking each other, does anybody know about this pharmacy? Is it for real or is it a scam? I need abortion pills and I'm considering ordering. And we thought, well, we're researchers. We can answer that question. So we started purchasing pills. A couple of years later, we saw that these MTP kits were available. And I usually have one to show you, but they are a packet of pills that has 1 mifepristone and 4 misoprostol pills in a blister pack. And that's what we saw was being advertised for sale in the United States. So we started purchasing. I was the person who did a lot of the early purchasing, and it was remarkable. They came in the mail and they were real, they were real pills. We had them sent to a laboratory and tested,
And
and
they
they were
didn't
the real.
require a prescription to get them? They would just mail them without a prescription?
These are e-commerce businesses, they're online vendors who are connected to the generic Indian marketplace. The pills are widespread in India. They figured out the market and they started shipping pills into the United States. So, we have tested them over the years. We continue to test them. We list the ones that we found to be reliable on our site. And we've been able to shape the market somewhat because we have criteria for our listings. For example, we wanted to try and avoid any kind of sites that had data security or data privacy issues. And so we started using a tool to monitor whether they were tracking keystrokes or cookies and things like that. And we set some parameters around what was acceptable to us, and we let the vendors know. And they, suddenly were in compliance with what we were asking for. Similarly, we heard from one of the support organizations in the United States, the Miscarriage and Abortion Hotline, which is a wonderful group of volunteer clinicians who help people answer medical questions about miscarriage and abortion for free. We heard that they were hearing from people who just got one of the single packs and, might be in a restricted state like Texas, and they were needing extra misoprostol. Sometimes that happens, that if you don't have a complete abortion, you need to take another dose of misoprostol. And they weren't having enough because they had only gotten a single packet. So we changed the requirement for listing on our site that it had to include at least 8 misoprostol with the order. And suddenly these sites, within a day or two, were compliant with that criteria that we had for our website. So we know a lot about these online markets, and we don't have any concerns about people using them. So that's one of the routes of access. There are also community networks. This is peer-to-peer support, sort of like mutual aid, and also harm reduction. These groups are also getting pills, generic pills from India, and they are either repackaging them or sending them in their original blister packs to people who request them, who live in restricted states. Their focus has been on restricted state access. And they also provide accompaniment, which means that if you need help and instructions, or you need somebody to be on text or phone with you while you're having your abortion, they will do that. Like a friend, right? A friend who is there to support you. And this model of care, of peer-to-peer mutual aid support, free, with accompaniment, really comes from other countries. It speaks to the history of abortion pills in the world, in the global context, which is that in the 1980s, it was women in Brazil who saw on the side of a common ulcer medication, Cytotec, they saw the picture of the pregnant woman with the circle and the line through it, which said, don't take while pregnant because it could cause a miscarriage. And these women said, I wonder what would happen if we took this to induce miscarriage. And they started taking the medication when they needed an abortion because it was illegal and unsafe. Because when we ban abortion or make it illegal, we make it unsafe for the woman, right? We know that from the history in our country prior to Roe of people dying. So what they discovered was that, yes, indeed, this would induce a miscarriage. They experimented with the doses. They talked to one another. They shared information. And lo and behold, just women to women sharing this information resulted in dramatic decreases in the amount of sepsis that was occurring. And the doctors noticed, they're like, where are all the women who are having abortions who come to me with sepsis? It wasn't happening anymore. It's a really remarkable story about how women were the ones who really figured this out and then shared with each other. And that history of that type of movement has now come to the United States. It was brought to the United States by Mexican activists who helped with access, and now it is people from within the United States who are helping one another in the restricted states all across the country with this type of access. And we believe that will remain regardless of a court activity or decision. And then the third type of access are these international telehealth websites. These are groups that do a little online screening. They have doctors behind them, and then they ship generic medications manufactured in India. And they either ship them from within the United States, so it's fairly quick, 3 to 6 days that they arrive, or sometimes they ship directly from India, so it might take a little bit longer to arrive. But still, they're backed by clinicians. They are reasonably priced, and they're using drugs that we believe are fine and of acceptable quality. So the courts, the politicians, they can do what they're going to do. And believe me, the attacks will continue in the United States. We're in a rabid time right now against abortion. But we believe that the safety of this pill, of this mifepristone pill and mifepristone plus misoprostol together, is very safe, very effective, does not need any kind of special expertise to use. And so unlike procedural abortion, where you need to have expertise in how to insert something in the uterus and suction the uterus, these pills can just be taken by the person who needs the abortion themselves. And they're so safe and effective that can even be done without medical supervision. So just the power of that technology of abortion pills is really why we started Plan C. We knew that as people learned about it and learned about routes of access to it, that it would really take off. And we always say the genie's out of the bottle. There's no going back, right? We're in a global economy. We have, access to these pills. They are produced by the millions in India, so readily available. And we believe they will continue to be available in the United States despite the political restriction of access to care.
Well, thank you so much, Elisa, for sharing your expertise and your information. And there's a lot more information at plancpills.org on the internet for those who are looking for information. And just want to say that a woman's control of whether to end a pregnancy is a fundamental right. And it's beyond annoying that Christian nationalist men continue to push their extreme agenda to insist that women bear children whether wanted or not. And as this drama continues to play out in the political arena and the courts, we're really grateful for organizations like Plan C that's providing reliable, safe information so that women can self-manage these issues at home and in a safe and effective manner. So thank you. Thank you so much, Elisa, for all you're doing to empower women and protect our rights. We really appreciate it.
Well, thank you. Of course, we want people to have access to as much care as they can get.
Absolutely. Democracy is on fire, but we, the people, have the power by voting to extinguish the flames of fascism. Let's do it. Thanks for listening and staying engaged. Democracy on Fire is on United American Network or wherever you get your podcasts. Please like and share.